The cosmetic surgeries that I'm going to focus on are very popular ones, especially now, today, very trendy: breast augmentations and BBL, Brazilian butt lifts. Breast augmentations are very common today. You can get the surgery with silicone or saline implants.
This is a saline implant and this is a silicone implant. The difference is what's inside. The gel that they make silicone implants out of is cohesive gel or gummy bear. Let's talk about the advantages of saline versus silicone. Saline implant has saline inside, and a lot of people feel that that's safer. However, the FDA and numerous organizations have done studies on silicone implants that have not found any link from silicone implants to causing problems such as autoimmune disorder or cancer. It just doesn't happen. The sad news is that 1 in 6 women get breast cancer, whether or not they have implants or not. So if you were my family member, I wouldn't hesitate to use silicone implants because they're more natural feeling and they look more natural. Let me show you why. On a saline implant, you can see these ripples on the edge. This is not very attractive for the appearance of the breast. So especially if you don't have very much breast tissue to begin with, you won't be able to hide these ripplings, and you'll see it on the side of the breast and you'll see it on the cleavage. What implant that you decide to go with depends on your consultation with your board-certified plastic surgeon.
The chest wall muscle important in breast augmentation is called the pectoralis major muscle, otherwise known as the pec muscle. This muscle extends from the arm bone near the shoulder and attaches to the chest wall near the midline. How the implant is placed in relation to this muscle is important in determining the final long-term result. The implant can be placed in front of the muscle. However, most surgeons choose to place the implants under the muscle, which is often referred to as a subpectoral placement. Firstly, an incision is made in or near the lower breast fold. The lower end of the pec muscle is identified and then detached from the chest wall at the lower end to make room for the implant. However, as the muscle remains attached to the overlying breast tissue, it doesn't retract or move too far. A space or pocket is then created under the pec muscle large enough to accommodate the chosen implant. Once the pocket is created, the implant is then inserted and positioned, and the wound is closed. Depending on the person's natural anatomy, in the early stages after surgery, the lower breast curve or underboob can sometimes appear very tight and flat, sometimes even having a slight groove within it. This groove is referred to as a double bubble. As the breast softens and the implant settles, this usually goes away. However, as the muscle remains attached to the breast tissue and close to the lower curve of the breast, then as this muscle contracts, it often pulls the skin in, causing a groove along the lower breast curve. This is referred to as a dynamic double bubble and is quite common.
Brazilian butt lift is a term coined to describe the action of two different surgical procedures: liposculpture, also called liposuction, and then harvesting that fat from the liposculpture and then placing it into the buttocks region of the patient, creating a more round, curvier shape.
I'm Dr. Constantino Mendieta, a board-certified plastic surgeon in Miami, Florida, the land of the bikinis. My specialty really has focused around the buttock area. It's become a subspecialty within plastic surgery. So today's case with Jessica was amazing because she had incredible anatomy to her. The problem is that her fat wasn't distributed right. So it's like having a gorgeous house, but you got all these trees in the front and you can't see it. Well, I removed the trees so you could appreciate the house. It's not just about the butt, it's about the entire body. It's about looking good when you're walking into a room, but looking even better when you're walking out of that room. So it's a front and back procedure.
My mother is Caucasian and my father is Puerto Rican, and on the Puerto Rican side, all of the women have round, beautiful booties and thick legs and tiny waists, so I'm hoping that today I'll be more like the family.
In the old days, it was just about removing fat. There was no artistry to it. And now we've found different anatomical styles that people may like.
Since surgery, my whole silhouette has changed really. My waist has shrunk. None of my clothes fit right anymore because my waist is so small. So it's kind of difficult to actually find clothes right now, but I feel like it's a good problem to have. The whole liposuction just really shaped me really pretty, I think, and it's very feminine and kind of sexy. I feel ecstatic, I feel happy, I feel anxious to show off my results. I feel like this is the body I was supposed to have. It fits with the rest of me, it fits with my family, and it just fits with everything I want to do in my life.